Hello and welcome to my presentation. I am a third-year DPT student at the University of Washington. The purpose of this video is to make up missed time during my clinical rotation. Today I'm going to discuss the exercises, precautions, and some tips that you can use after your total joint replacement for the knee or hip. I will be using the total joint precautions and exercise handouts provided by Overlake Medical Center in Bellevue, Washington. I have broken up the video into several sections by the specific type of joint replacement. As a disclaimer, Overlake Medical Center and the University of Washington do not necessarily share my opinions or views on this material. However, they did provide the exercise and precaution information used. As a helpful tip, some of these exercises are similar but with some slight variation depending on the surgical approach. Thank you for watching my video. Next, we're going to be talking about total knee replacement, precautions, and exercises. For terms of precautions, there pretty much is only one, and that's weight bearing is tolerated on the operated side. Other than that, you don't have to worry about what position you're in. In terms of exercises, there's ankle pumps, knee locks, heel presses, and glute squeezes. And for those 4 exercises, you're going to be performing those every hour for a total of 10 repetitions. So for the first exercise, ankle pumps, you're just going to pump your ankles up and down, holding for 5 seconds. For the next exercises, called knee locks, you're going to press your quads down towards the table and then relax after 5 seconds. For the next exercise, called heel presses, you're going to press your heels into the table for a total of 5 and relax. Okay, and then finally we have glute squeezes. You're going to squeeze your glutes until you raise and relax, and do those for a total of 10 times for 5 seconds. So the next exercises you're going to be performing each one 3 sets of 10. So the first one, heel slides. My right leg is the operated side. You're going to slide your heel up, okay, as much as you can tolerate without too much pain, and back down slowly, okay? Sometimes your heel can get caught like mine did. Just try to smooth it out as much as possible. For your next exercise, you're going to perform lower leg lifts. This is when you keep your legs straight and lift up like that, holding for 5 and coming back down, okay? Repeat that 10 times. Next exercise those were straight leg raises. This next exercise is called lower leg lifts. You're going to place this towel roll or a blanket roll underneath your knee, and you're going to straighten your leg out, holding for 5 seconds. Okay, for the next exercise, you're actually going to come off of the table here. For this exercise, you're going to keep your foot planted, and you're going to lean forward until that knee bends. See how you can see I have this bend here, and you're going to try to push that as much as tolerable, and then after 10 to 15 seconds, you're going to release. Okay, do that 3 times per day. Next exercise, you're going to place a towel roll underneath your ankle, like so. And you're just going to relax in this position, allowing your knee to straighten out. And you're going to do that by putting an ice pack over your knee that they provide to you in the hospital. And you're going to hold this for 15 minutes. Hi, now I'm going to go over the total hip exercises for the posterior approach. Now, you'll also have some precautions when you have a posterior approach, and it will take some time for your hip to heal. So while it heals, it's important that you protect your hip from harmful postures. Now, these will be provided to you by your surgeon, and so make sure you're following your surgeon's specific precautions. So the first precaution that is standard used for posterior approach is do not turn your leg in like this. Okay, this is called medial rotation. You want to keep your knees pointed straight up when you're moving in bed and when you're moving around. So do not let your knee come inward like this, where you're rotating your hip inward, okay? Because that's a precaution. Second precaution is do not cross your leg over or bring your hips together. So if my left hip is the operated leg, then you're not going to want to cross over like this, okay? Or bring it past midline, okay? Another thing to do is to not bring your hip past 90 degrees. In this position right now, I'm at 90 degrees. So if I were to lift up my leg, that's breaking my precaution. Or if I lean forward, that's breaking your precaution. So it's much better when you're moving around that you stay reclined like this, okay? This is a really good position for you to learn to move in, because here you're creating more space right at your junction, at your hip junction, so as to allow for more movement, okay? So you don't want to be moving around like this, because once again you're breaking your hip precaution. That's one that people tend to break the most, okay? So you want to perform each exercise 10 repetitions of these following exercises 3 times per day, okay? The first exercise, as I've already shown previously in my video, is ankle pumps like this, okay? You're gonna hold this position for 5 seconds, slowly up and down. Next thing you're gonna do is the ankle or the quad sets, where you lock your knees down like this, hold and relax. The next exercise, you're gonna do glute squeezes like this, glute squeezes, and then you hold that and hold for 5 seconds. And so now for each of these, you're going to perform 10 times every hour. Okay, for the following exercises, you're going to perform 3 times per day for 10 repetitions. And that first one is get in your reclined position because of your hip precaution, and you want to bring your hips up like this, or sorry, you want to slide your leg up and then straighten out. Okay, you don't want to be forward when you slide up because you're breaking your hip precautions. Okay. The next exercise is going to be a lower leg lift. This is with the towel roll. You're going to stick under your knee like this. And you're going to be in your reclined position, and you're going to straighten that leg up, hold for 5, and slowly back down. Okay. The next exercise you're going to do is you're going to take the towel roll and put it in between your legs like so, as to block your knees from getting too close. And you're going to bring your left leg or your operated leg out towards the side like this, and then back in, and you're going to stop before you get to midline. Okay? Once again, being mindful of not breaking your hip precautions. Bring your leg out and bringing your leg back in like so. Okay? You're going to do that 10 times for 3 sets. Next exercise, you're going to stand up and use your walker. So like if I'm getting out of bed, once again, pretending that this is all real, use my walker, my leg out. We're going to put one hand on the walker, one hand behind you, and you're going to stand up nice and lean back, and you're going to stand straight up like this to avoid being the hip. So once again, continuing, if it's my left side for this exercise, I'm going to scoot my walker out in front of me, and I'm going to bring my leg out to the side to about the end of the walker and then back down. So only about 10 degrees. Okay, out to the side and back in. Hopefully you can see that. Now when I turn this next exercise, I'm going to turn to the side so you can see that I'm going to bend at my hip and knee till my foot lifts off of the ground for 4 to 6 inches, and then return back. So these are almost like a single leg march, as I like to think of them. Bring that leg up and slowly back down. When you're walking after a total hip replacement with a posterior approach, it's important not to break your precautions. So one thing that I want to show you is that, especially when turning, this is when people can have a problem. So if I had the surgery on my left side, it's important that when I'm turning left, that I'm not turning like this, causing my left leg to internally rotate. So it's important that you pick up your leg when you're turning left, like this. And this will help you keep your toes straight and not break your precautions. It's not as big as a deal if you're turning right, if I had a left posterior hip, but at the same time, it's just probably easier to learn to pick up your feet when you turn after surgery. Okay? I'll be talking about total hip precautions and exercises for an anterior approach. So, similar to a posterior approach, there are precautions, namely one precaution, but the precaution is completely different because the approach is different. This time they're making an incision in the anterior aspect of your hip, and the one precaution is to not hyperextend your hip, such as dangling your leg over the side of the bed. So that looks like this. So when you're getting in and out of bed, see, I just did it. What you're trying to do is to limit, if it's my left hip, you don't want to let your hip hang off the side, or your leg hang off the side of the bed, allowing your hip to hyperextend. So this is not a correct position. You want to make sure that whenever you're getting out of bed, that you're getting out with your legs together to avoid this motion. See, like this, even getting back into bed, this is a no-no. So you want to make sure you're not hyperextending your leg off the side of the bed. That's when people typically tend to break this. But the good thing is that's the only precaution for an anterior approach. But it's going to be according to your specific surgeon. So you want to make sure that you understand your precautions for that particular procedure performed. Okay. With these following exercises, you're going to perform each exercise 10 times. Okay. And for most of these exercises, you can perform them 3 times per day, except for the exercise I'm going to show you next, which you're going to perform 10 times every hour. And that includes ankle pumps, you guessed it, slowly pointing both your feet up and down. Next one you're going to do is knee locks or quad sets, where you tighten both of your thigh muscles by pressing your knees down towards the table. You're going to hold that for 5 seconds. And then the next one is you're going to do glute squeezes, where you squeeze your glute muscles and you hold for 5 seconds. The next exercise, if your left hip is the anterior approach, you're going to slide your heel up towards the side here on the bed here, and then come back down. You're going to hold this top position for 5, and then you're going to bring it slowly down. We take our towel roll for the next exercise for the lower leg lifts. Put that underneath. Straighten that leg until it's nice and straight. Hold that at the top for 5, and then bring slowly down. For the next exercise, you're going to put the towel roll in between your legs, and you're going to bring out to the side like this, and bring back slowly in. Unlike the posterior approach, the anterior approach does not have any precautions for this exercise, so you don't have to worry about that. Bring it back in. And then for standing exercises, you're going to use the walker for the first exercise, and you're going to bring your hip out to the side like this with your walker out in front of you, and you're just going to go to about 10 degrees this way, 10 to 15 degrees. And then your next one, you're going to stand up nice and tall, and you're going to lift up your leg like this. Well, the single leg marches is what I like to call them. Hold it at the top for 5 seconds, about a 4 to 6 inch depth. Thank you very much for watching this video. Hi, now I'll be talking about total hip precautions and exercises for the anterolateral approach. So when you have an anterior lateral approach, it means that the surgeon has decided to do a anterior lateral approach. So they're coming in from the more of a side angle. So your precautions are going to be different than an anterior approach or a posterior approach. They're going to be similar, but they're going to be different. So the first thing you want to do, or that you do not want to do, is to actively bring your leg out to the side. We would call this is hip abduction, and so that it can look like this, and you're bringing your leg out like that. Okay, so that's different from the other ones. You're not doing this. Bring your leg out. Another thing you can do, standing, it looks like this, bringing your leg out to the side. Okay, you want to avoid that. Next thing you do not want to do is to hyperextend your hip. So, such as dangling off to the side of the bed, like this. Okay? Either getting in or getting out. You do not want to be in this position. So, with both feet, try to move over, and that helps you protect you from breaking your precautions. Okay? So, do not bring your leg and let it hang off the side of the bed. And be sure to follow your hip precautions, and make sure you speak with your doctor to make sure that you know what your hip precautions are. In terms of exercises, you're going to perform each exercise for 3 sets of 10. That first exercise is called ankle pumps. You're going to pump them up and down like this. You do those 10 times. Next, you're going to do knee locks, where you squeeze your quads together like this, pushing your knee down towards the table, holding for 5 seconds. Next exercise is called buttock squeezes or glute sets. You're going to squeeze your glutes together till you rise, and then slowly down. Okay, you can do that 3 sets of 10. Okay. Next exercise, heel slide. Slide your heel up like so, and back down. Okay, slide up, hold for 5, and back down. Okay. Next exercise, you're going to take your towel roll, put it underneath your knee like this, and you're going to just straighten out that leg. These are called lower leg lifts or terminal knee extensions. You're going to hold this position for 5 seconds. And finally, the last exercise you'll be doing is standing march, or single leg march, or standing hip flexion as it's called. You're going to bring your leg up and back down, holding for 5 seconds at the top. Okay, thank you for watching my video. The next thing we're going to discuss is how to appropriately fit your device for yourself. So the first thing you want to do is drop your hands down by your side like this, and where the crease is on your wrist is going to be the appropriate height that you want to set your walker. So in this case, the walker's set at the perfect height, because if I drop my hands down by my side with a slight elbow bend, you can see that it hits my wrist right at the crease. So that's exactly where we want to have it. You're going to want to put the cane in the hand of the opposite side that's grabbing the rail. And you're going to want to step up with the good side or non-operated side. And with the cane, push. Okay. Same thing, and push. When you turn, switch your hand, the cane and the rail, and you're going to go down with the operated side first, and the cane. Down with the bad. Okay. When you're approaching the curb, you're going to want to lift the walker up towards the step, and then or to the curb, and then go forward with your good leg or non-operated side, and then bring that bad leg up. And then same thing when you're going down, you're picking up your feet when you're turning. You're going to put the step down, and you go down with the bad or my operated side, and then down with the good. So when you're getting inside and out of your car, it's important that you have the seat reclined back and that the seat is pushed back as far as it can go. Okay? So when you're getting inside the passenger seat, if my left side was the operated side, then what I'm going to do is leave my leg nice and long when I get into the car. So I'm going to reach back, find the seat, and this guy right here, and I'm going to sit myself down slowly, keeping my hip from breaking my precautions. If you have that, then I'm going to lean back like this, bringing both feet together, and I'm going to use the handle here, bring both feet in like this. Notice I stayed long the entire time, making sure not to lean forward. And again, coming out this way, bringing your hips, leaving it nice and long. Try not to break those precautions. Hands on the side here, and stand up like this.